Hello, and thank you for joining me for my presentation today on vulnerability in the elderly population. Before we get started with this presentation, let me tell you a little bit about myself and why I have such an interest in this topic. My name is Stephanie Smith. I've been a registered nurse for over 20 years, 18 of those in a skilled and long-term care facility where the majority of the patients were elderly, or as we refer to, geriatric. I'm fortunate to still have one grandparent living. That's my granny's beautiful face in the picture. Unfortunately, her dementia is progressing and she is physically and cognitively declining. My mom, uncle, and I are now her advocates as she is in a long-term care facility. She is the reason I chose this topic, as I am always looking for ways to better her care and to validate that what we are doing for her is what is best. So let's get started. Adults over the age of 65 are more likely to encounter diseases related to aging, such as Alzheimer's disease, diabetes, heart disease, kidney failure, arthritis, hypertension, chronic obstructive pulmonary disease, and cancer. The elderly are also more susceptible to infections. So just a little statistics. The 2021 American Community Survey estimated that there were almost 56 million people aged 65 and over in the United States, of a total population of almost 332 million. So that's about 16.8% of the population being over the age of 65. What factors contribute to elderly vulnerability? Older adults appear psychologically vulnerable because they are subjected to mental health changes and to progressively diminishing conditions such as depression, agitation, and anxiety. They also start to experience physical disabilities such as poor vision and unsteady gait, which leads to falls and could result in injury. Cognitive impairment or changes occur such as memory loss. They lose their decision-making capacity. They also experience functional limitations for medical care, medications, food, and other essential needs, as they no longer are able to drive, and they lack assistance from family, friends, and or caregivers to take them to the doctor, pharmacy, or to get groceries. If older adults are not able to get the medications, equipment, or special care they need, they can be at increased risk of complications and even death during an emergency. Older adults are more vulnerable than younger adults during a disaster because they are more likely to have impaired physical mobility, diminished sensory awareness, chronic health conditions, and or social and economical limitations that interfere with their ability to prepare and respond to disasters. So how can advocacy play a role in addressing vulnerability in the elderly? An advocate for elderly will make sure that they have access to adequate nutrition, as well as having social interaction and community activities and community events. The focus of an advocate is to provide support, assistance, and encouragement for both the senior or elderly and their family. A healthcare advocate's role entails helping patients access healthcare, educating patients and or their families so they can make well-informed healthcare decisions, and guiding the patients or family members through their medical care, insurance questions, and administrative and legal tasks. Historically, among the categories of vulnerable people, older people are predominant. An older adult is someone who is in a state of constant cognitive and physical decline. This condition leads to progressive depletion of functional reserve mechanisms, reduced homeostatic capabilities, and is frequently accompanied by complex comorbidities, which are often further complicated by geriatric syndromes and frailty. Conditions such as lack of accessibility and acceptability to quality health care were two factors identified as barriers to older adults from accessing health care. Other often mentioned factors were income insecurity, unfriendly environments, and psychodynamic factors such as their uncertain future and fear of death. These conditions may further worsen their stability and increase their vulnerability. Loneliness, and in some circumstances even isolation, may also characterize old age. Many elderly people live alone, may be widowed, and often live in nursing homes. At the same time, some of their peers may remain in their own homes, accompanied by caregivers who become their sole companions. What are some successful advocacy efforts or initiatives? How can we help? With the use of media and the internet, or simply mail, we can write letters to the editor about issues. We can go to town hall meetings that members of our Congress hold and ask questions about senior issues. We can invite our members of Congress to visit a specific organization. We can build relationships with congressional staff who work in the state or local district offices. Some advocacy strategies that could effectively address vulnerability are: 1. To pay attention. Observe and take note of what's happening. What are the signs of decline and need for additional assistance? Talk to the elderly. Ask them how they are. Do they need anything? Designate an advocate. Attend appointments. Communication is key. Ask questions. Learn about their condition, their challenges, and seek advice. Seek advice from the physician. Utilize community support and assistance. In conclusion, the elderly are near and dear to my heart, as I devoted over 18 years to the skilled nursing and long-term care facility. We can help elderly vulnerability by simply listening. Stop and talk to them. Speak slowly and clearly to ensure they can hear you. Pause and give them a chance to process what you said and then respond. Investigate what they tell you. The last thing elderly people want to do is become dependent on others. They see their decline in physical and cognitive abilities. They don't need or want others to point them out to them. Offer assistance with tasks that you see them having difficulty with. Technology is challenging. Rather than doing it for them, show them how to do it. Offer to help them get community assistance. Help them with transportation to doctor's appointments, to get their medicine, to go to the grocery store. One day we will all get old. How do we want to be treated? I have included a reference page in case you would like to read more about the information shared in this presentation. Thank you for your time.